Welcome to Diabesity Dialogues. I am Jamy R., professor at Wake Forest School of Medicine in Epidemiology and Prevention, and I am joined by my esteemed colleague, Dr. Bob Kushner, who is the Batman to my Robin, the Tom to my Jerry, the Ginger to my Marianne. So, Bob, I'm going to let you introduce yourself here.
Oh, how long did you rehearse that? Oh my goodness, Jamy. I'm Bob Kushner. I'm a professor of medicine and medical education at Northwestern University, Feinberg School of Medicine in Chicago. Jamy, always a pleasure to be with you.
So, welcome to our final episode. We're diving into a crucial aspect of diabetes care, individualization. We'll be exploring how you can ensure that the patient's voice is heard and valued in therapy decisions. We've been highlighting that throughout the series, but today we're going to spend a little bit of focus on that. So to start off, let's visit Damien. We talked to him before. We heard from him before. He's a patient with type 2 diabetes, and let's hear his perspective on the topic. Trust us, his insights are sure to spark some thought-provoking conversation.
Hey, I got a quick question. For people who's diabetic or someone who's dealing with someone that has diabetes. And I'll go first. I feel like it's the care that the doctor's giving. I feel like some doctors are treating diabetes like one shot fit all, like they prescribe the exact same thing for every single diabetic person, and they're not getting to the root cause of the situation. When I first get diagnosed, I go to urgent care because I was having symptoms. From urgent care, they send me to the emergency room. From the emergency room, they send me upstairs to be admitted to the hospital. And then from the hospital, 4 days later, they send me home. When I first got diagnosed as a diabetic, it was more a mental thing for me. I actually slipped in a state of depression, and I had to go talk to someone and work through all them issues that I was going through. So no matter what the doctor gave me, no matter what the doctor prescribed to me as far as my diabetes, I wasn't mentally there to even start helping myself to get right. Also, I don't think the doctors calculate someone's lifestyle. I just think these doctors are prescribing this medicine based on the previous diabetic before them, based on the previous diabetic before them, based on the research that they've done. That's not quite working for us. We all know diabetics are different. So go ahead and like, share, and comment. Thank you.
I'm interested to get your take on Damien's experience, especially as it relates to the idea that, doctors are not really, paying attention to some of the individual characteristics of the patient to tailor treatment, or even thinking about things like he said, his mental health state. And is he prepared to engage in treatment, or does that need to be addressed in addition to the other things that are happening especially in this new diagnosis of diabetes? What are your thoughts?
Yeah, you certainly bring up a good point. We all know, anyone who's been in practice probably more than a month knows that everyone has their own story to tell and their own journey. They arrive at a particular diagnosis or disease or condition through multiple directions. And it's so important that we have that communication open with patients to really hear their voice, which is the whole point of showing these TikTok videos. The other point, Jamy, I want to, before I hand it back to you, I want to bring up is the whole idea when he said, and it really resonates with me, is doctors use a medication that was successful on the last medication that they used in a patient. We hear this all the time.
Yeah.
And it seems almost as silly. If someone with hypertension, all I use is a diuretic and I don't have anything else in my toolkit, how ridiculous is that? With diabetes, I use metformin, but I don't go beyond that. So we really do, as a clinician, be an adult learner and really understand what are the tools that we have in our toolbox that could be used on an individual basis with that patient.
Yeah. And, the thing that's, I think, really important to me in that discussion, Bob, is what you brought up around the context of the patient, right? What's their environment? What's the background? What are the things that are going to enable them to actually do the treatment, implement the treatment, or things that will be barriers to implementing that treatment? So you could come up with the best treatment plan in the world. 9 out of 10 dentists might approve, but if, you can't implement it when you walk out the door. I mean, I've had plenty of patients come back to me and say, we talked about this, but as soon as I left, I just, that little handout you gave me, I just put it in the trash because I knew I couldn't do that. Right. I sat there and nodded my head and agreed. And they came back with a moment of honesty and said, I just didn't tell you, or you didn't understand when I said that this was a problem. This is a real problem. And it's going to create this huge barrier that keeps me from doing any of this. And we've got to deal with that first. And that's reality. I think that's a lesson that we all can learn.
Yeah, it's heartening to listen to this TikTok video. And we don't often hear patients talk about us, when they leave, but getting a little window into what they're perceiving or what they're hearing or not hearing is really just so instructive. It really is. Jamy, I'm going to flip this back to you. So I think it's important to really establish relationships with our patients where they feel there's a safe space to discuss any concerns or issues they're experiencing with their therapy or their diabetes journey, which is kind of really summarizing what we just talked about. So let's revisit Ashton's TikTok on self-advocacy.
Write down any questions or maybe practice what you're going to say to your doctor before you even get to your appointment. These conversations are hard and it's normal to be nervous. Writing it down will just help ensure that in the moment it doesn't get lost. And perhaps you could even practice setting boundaries with your partner, friend, therapist, so when you get there, it's not as scary. I can't believe how many people don't know this, but you do not necessarily have to be weighed when you go to the doctor. You can definitely choose to be blind weighed, where you turn around on the scale and they write down the number, but they should not tell you. Just forewarning, this may pop up in your patient notes on your patient portal, so just be careful navigating that. There are very few scenarios in which a patient must actually be weighed to receive proper care. And last but not least, if you're able to, bring a friend or a partner to your appointment with you. Because if it hits the fan, this person should be able to step in and help advocate for you. They can also help validate some of your experiences and help facilitate that conversation with your doctor. Or perhaps remember some of the important details that you discussed with your doctor during your appointment. But for this purpose, if you don't have someone that can go with you, ask to record your appointment. That way you can go back and listen to the important pieces later if you need to. All right, I want to know, was this helpful? Let me know in the comments.
So Jamy, what are your thoughts about I guess what I'm using is creating a safe space to ensure optimal maintenance of diabetes and obesity treatment in our patients?
Yeah, in my reaction to Ashton's video, which I think her points are definitely very important and well taken. I think it's important for us as clinicians to see ourselves in service to the patient, right? We're the waiter, if you will, in the analogy, and the patient has the menu. And we might make recommendations about what good choices are on the menu, or say, no, we don't have that in the kitchen today. But it's not our job to make the choice for the patient in terms of how they want their health care. And it's a partnership. So I think all of her points about creating a safe space and having a partner there to help with making that assurance, to being able to write down questions ahead of time. I really find that useful. I really love it when my patients come in with an agenda, and I can answer those questions, and we can walk through those things. I can answer their questions. They can respond to my questions, and we can set an agenda going forward for the next visit. So I really like that. So let's shift gears. I want to really kind of pick your brain a bit here. And as compared to episode 3, I get to be in the driver's seat and do a little rapid fire scenario with you. Okay.
How do you feel about that, Jamy?
Oh, I like this. Yeah, I like the driver's seat. So let's talk about. I want to see how you go about doing this in terms of shared decision making, right? And I want to see, how you model language. So I'll give you the scenario, and you give me a quick couple of lines of how you deal with this dicey topic or topic that could be sensitive, especially when it comes to shared decision making. You're up for it.
Okay, I'm ready to go.
All right.
I got my seatbelt on.
Let's do it. Scenario 1, patient you haven't seen in years, and you've noticed they've gained a significant amount of weight. However, they never seem to bring up the topic themselves.
So I'm thinking you don't want to talk about weight when it comes out of left field. So if someone comes in with an earache, you don't want to say, oh, and by the way, you've gained a lot of weight, right? So you don't want to do that. You want to make sure it's pertinent within the medical encounter. But bringing it up, first thing I would say after, let's say, look at the weight trajectory. We talked about that in the last episode. So they acknowledge perhaps they've brought up weight. I use the phrase, is this a good time to talk about your weight? So it's something like this. I look at electronic medical record. It looks as though you've gained about 5 or 10 pounds in the past year or two. Maybe it's pandemic related. Is that true? What was going on? And then I'd say, is this a good time to talk about your weight? So you're asking for permission. It acknowledges that this may be a sensitive topic. And I'm proactively ready to be here and take on that responsibility of helping you if that's what you want.
Wow. Okay. So ask for permission, provide some options or solution, or be part of that solution. Great.
Yep.
Love that. Scenario 2. We got a patient where weight loss isn't the focus. They are focused on the complications. So I'll even make it more specific. Having knee pain. But, recognize that, I have a higher weight, but my knee is really the problem.
Yep. Make sure you take care of the problem. We talked before about ascribing everything to their weight, right? There's a cartoon, right? There's like a knife or a hammer in the head, and they go, you're overweight. You wouldn't have that in your head if you weren't overweight. And it's so true. So always acknowledge the problem, whether it's backache or GERD or knee pain or shortness of breath. There's something going on here that you want to pay attention to, acknowledge, alleviate that pain. If it needs more diagnostic work, upper labs, go ahead and do so. But I think it's also important to inform them that there are other alternative, additional approaches to be thinking about to make that complication better. And knee pain is a great example where we know from a mechanical point of view, extra weight on weight-bearing joints can make those joints worse. So bringing up the topic of healthy living, losing weight is another approach that we're going to be using to deal with your knee pain once we've addressed everything else we need to do.
Got it. All right. How about this scenario? Someone who has experienced medical trauma and is really just not interested in dealing with weight-related issues because of the trauma that they've experienced or the experience they had in the healthcare system that was very stigmatizing.
Yeah, we just heard in the last TikTok video, which I want to give me a chance to comment now, where she's talking about her 5 tips of advocacy, and one of which is, I do not need to be weighed. Okay, when someone says that to you, you want to understand what's behind that statement. Is it because they've been shamed for decades? Is it their own they value everything based on the scale versus other attributes? Have they had family members putting them down for years talking about weight? So that's all part of that weight bias and trauma as it relates to being weighed. I would never force someone to get weighed and look at their weight and tell them their weight if they're not ready for that. So bottom line is, Jamy, is to really hear their story, acknowledge it, try to understand what's behind it, and help them through that in a healing way, if at all possible.
Wow. Well, that's why he's in the Hall of Fame with responses like that. So, it's...
When are you up for that? You're up for that soon. You must be up for that real soon.
I am not anywhere near...
Class of 2025. I see it.
I'm not anywhere near senior enough, Bob. So, I think this idea of shared decision-making is so important in healthcare, and especially when we're talking about really helping patients improve their health through obesity-centric treatment of diabetes, that these conversations are worth the time. We all work in time-pressured situations, but these are the conversations that I feel like really help set the basis for a successful partnership. And with a shared decision-making approach, you as the clinician help to bring the evidence-based information to the conversation. You support the deliberation for the patient and give them those options and explore those. And you try to do that in an unbiased way. And then frame the process and help people understand, here's what the progression looks like, or here's what the treatment plan would look like. Provide people with tools and give them access to those tools, and provide insights for what you think might be an optimal treatment strategy in ways that you can support them. So I really like what you talked about in terms of asking permission and then being there for support. Those are things that I think a lot of patients don't feel like they get in an encounter with their primary care professional. So I think shared decision making is really critical in order for us to be successful when managing our patients.
Thanks, Jamy. Those are really good comments about shared decision making. But let's go ahead and wrap up on a positive note. Listen to our final video where Jernine gives us her vantage point of what shared decision making looked like for her.
Tell me ways that you advocate for yourself to your doctor when discussing treatment options for obesity and/or type 2 diabetes. Well, I'll go first. In December 2022, I just reached the end of my rope. I had my physical scheduled with my primary care physician, and I just said, you know what? I need help. After all of the dieting, the exercising, and just not feeling like myself, I knew something was off. I knew something was wrong. So after asking my primary care physician for help, we discussed some options and we came up with a treatment plan. But that's my story. So I'm interested to know, what is your story? How do you advocate for yourself to get proper treatment for your, struggle with obesity or type 2 diabetes? Let me know in the comments.
Yeah, so that's a really insightful comment or post shared by Jernine related to really just saying, look, I'm in control of my healthcare. I am the consumer here, and I want to engage my expert clinician in order to get the best treatment plan that I can. And I think that no one should feel bad about asking their provider, their healthcare practitioner, to really sort of step into that role and support them in that type of decision making. That's what we want. We want engaged patients who really understand and want to lay out a vision for where they want their health to go. And I appreciate that and applaud that, and I think we should be advocating for that. So this wraps up episode 4. Thanks again, Bob, for your expert commentary and sharing of your knowledge. There are a multitude of options for our patients with diabetes and obesity or overweight. In order to find the right treatment for the right patient, you need to know your options, your patient, the right treatment, the right time, but you have to match those with the patient's goals and values and preferences. That's what we've been talking about. That's what shared decision-making is all about, matching those things up. So Dr. Kushner, it's been a pleasure to be a part of this series with you. For credit information, complete the post-assessment evaluation to get your credit. And see you next time on the Dialogues podcast.